Hello class! In this video, we are speaking with Eddy M. Gana Jr., a social worker.
Hi there, my name is Eddy M. Gana Jr. and I'm a social worker.
Eddy, could you say a little bit more about where you're currently working, what your title is, and a little bit about where you went to school?
Sure. So currently I work at SIPA, Search to Involve Filipino Americans. It's located in historic Filipino town, and it is a nonprofit that specializes in social services. And so for me, myself, my role there, I serve as an in-home outreach counselor. So in a nutshell, what I do is that I visit families' homes and I provide counseling services to them. Particularly with this role, we are in a subcontract with Chinatown Service Center, which has a contract with DCFS, so we get referrals from DCFS. And if you don't know what DCFS is, Department of Children and Family Services. And so I work with families between 3 to 6 months on their personal goals and help them along the way to ensure the safety of their children.
And where did you get your training?
And my training, so I first went to school, well, my undergraduate career at UC Irvine, and my majors were in psychology and criminology. And then right after that, then I went into UCLA Extension and I got a certification in alcohol and drug abuse counseling. And then at USC, I just graduated last year, have my master's in social work. And throughout all of that, I received various trainings, such as with motivational interviewing, which is an evidence-based practice, as well as problem-solving therapy. I also have some experience with Incredible Years, which teaches about effective parenting skills. And it's a wide array of trainings that was offered.
Awesome. Can you also share any other identities that you may have beyond being a social worker?
Sure. So aside from being a social worker, I am also a spoken word artist / poet. I truly believe in the therapeutic elements of self-expression for personal growth and also for greater social change. And with that said, also I'm a community organizer of several groups and collectives. I'll just round it down to maybe like 2 or 3. It's a Kabataan Makabayan, or KMB Pro People Youth. We empower the youth to organize and mobilize around issues that affect the local communities in the Philippines, as well as Sunday Jump, an open mic series in historic Filipino town, and then Filipino Wellbeing Summit. And so that's a collective of mental health professionals of our community.
Awesome. Mm-hmm. Definitely a lot on your plate.
There's a lot there.
But it all kind of sounds connected to your community.
Yes. Community means a lot to me. So whichever way that I can provide and be of service, then I'm down with it.
So can you share a little bit more like high level, why do you do social work and community work, and what kind of motivated you to do that?
So in terms of my motivation, I would have to trace it back to when I was a youth, back in high school. And I got involved with this group called Filipino Youth Coalition, and it was under a nonprofit called Filipino Advocates for Justice. And so through that, I was able to really find myself, because it was during a time when I felt alone, I didn't feel connection. Looking back at it, experiencing symptoms and signs of depression and anxiety. And I was able to really find out who I am and also explore what my identity means to me, what my culture means to me, and using spoken word. That's where I first delved into spoken word to share my story. And so that was led by a lot of community organizers, but also a social worker there by Chris Cara. And so with his mentorship and counseling there, I was able to really build that confidence and that self-esteem. And so bringing back to today, I really want to give that back and carry that forward for youth, for families who may seem or appear lost in their lives and may need some guidance here and there to get back up on their feet.
Yeah. That definitely resonates with me as someone who also, growing up, felt some disconnections from, feeling like I belonged and whatnot. And it's great to see how you've taken those experiences, the positive experiences that you've had, finding yourself, finding your community, and turning that into a career.
Yes.
That's awesome. So can you, I know you shared what you do now.
Sure.
Can you describe what your career path has been thus far, like starting off in college to getting to where you are now?
Okay, so in college I mentioned that I majored in psychology and criminology. So during that time, not only was I studying, but I was fortunate enough to be part of a program there called Coach. And Coach means conquering obstacles and overcoming hurdles. And so it was a peer mentorship program of such where I was able to work with undergrads on their personal, emotional, social, and academic goals. And so that was through the UCI Counseling Center. And that's when I first got my feet wet in terms of what is counseling, what is self-determination, what are goals, and what is realistic and not realistic. And there I was supervised by another social worker there. Her name was Mariko Adams, and she was a licensed clinical social worker, and really planted that seed in me in what I could do as an individual to help youth, to help peers, and ultimately to help them. Yeah, and then from there, I graduated, right? And then I wanted to explore the field of psychology and what kind of roles. And so I then worked as a behavior therapist. So behavioral intervention, I was trained in applied behavior analysis. And so I worked with children, youth who have autism and related disorders. And so I conducted sessions one-to-one, also in class settings. And so I had experience not only in the home, but also in the school, so working in special education. And I truly believe that when you work with a population, it's not in silos, right? There's an overlap, or like the reason why you work with a population is not just because of X, Y, and Z, right? So like I'm working with a population of autism, right? And some folks may just think, oh, it's just behavioral issues. It's like, no, what other issues come up? Issues of depression, anxiety, mentoring, especially when I was working at a high school in downtown LA. I saw a lot of that. And so my role was not only to provide like social skills, but also how can they help in terms of like develop more coping skills effectively. And so as I was going through that, I mentioned I went to UCLA Extension in alcohol and drug abuse counseling. So I was doing a lot of things, but then during that time I was at the Asian American Drug Abuse Program. And so then I was working with the population, affected by addiction, and then getting that perspective as well too. And then for most of those folks there, they were from like low income working backgrounds, working class backgrounds. So just like a wide array. And then I truly believe that through all those different experiences, they would like narrow down, okay, so what do I want to do next, right? Like what population would I want to work with? And how could I develop and I guess tune in my skills? And so I decided to then apply for USC, or School of Social Work, so I can see like what else I can tighten in terms of being more attuned with folks' emotions and being present with them.
Yeah. It's great to see how throughout your experiences, you were exposed to social workers. To kind of model that for you. But then also viewing people, the clients that you work with as full humans, and not just, okay, well, I'm here to work on this specific thing, but also understanding, okay, well, there are other aspects to this individual, and learning or trying to learn how do you address those other aspects of who this person is. And so I think that's really helpful for a student. Not everyone in this class is thinking about social work, although there are some who are.
Oh, there's
right?
some already. Right. See you.
Yeah, but also trying to think through, okay, well, yes, I may be seeing this person for physical therapy, but, maybe they're also going through some kind of substance use issue, right? Or
Mm-hmm.
I am seeing this patient for, I don't know, in the emergency room, but maybe they also are low income and then they face all these other barriers, right? And folks who are in social work can work with these individuals to help them handle what those other social issues are that they're going through.
Right. Yeah. So as a social worker, right, you can provide that expertise. I actually want to share an experience that I had through my internship last year at Kaiser Permanente, where I dipped myself into medical social work. And so what's important to recognize is that, yes, it's important that when you are in a role like such as a doctor, right, and you're working with a individual, and it's also important for you to be aware of depression and anxiety, right? So be aware of that, but then also it's not expected for you to be overall so experienced in it, right? And that's when you do consultation. Like that's the essence of medical social work, and I feel for a lot of mental health professions or any profession in general that you work together as a team. And so that was one of the learning lessons I learned through my time at Kaiser Permanente, because I would speak with the doctor. The doctor, would be transparent, be like, "Oh, I noticed some symptoms here. What are your thoughts on it?" And then you have a dialogue about it, so you have a full picture of what is happening with that patient or client. Again, it's the multidisciplinary approach. And then never feel like you have to be like a super person, that you have to know everything from like A to Z. Like stay in your lane. And then if you ever need help, you can just like roll down that window and ask for help. And then, the person they're right next to you, hopefully it's not LA or anything like that, but, be like, okay, I can help you out. Of course, that's not an ideal situation, but I have seen it happen, and it does happen.
Yeah.
And so we want to emphasize that, stay confident in the skills that you have, develop that, stay in your lane, and consult.
Yeah. So you all students, being part of this class, you're learning about all these different careers, and so hopefully you can take Eddy's advice and just have a better understanding of what other health professionals have to offer as far as their expertise. So thinking about your career thus far, what's kind of the best part about doing the work that you do?
The best part, well, actually, recently, because I just got hired at SIPA.
Congratulations.
Thank you so much. And so I am right now working specifically with Filipino families. And while I've had worked with Filipino families before, that wasn't primarily all or most of my clients, but now it's all of my clients. And earlier I mentioned the community organizing work that I do, and that's Filipino American community. So now I'm also able to be there as a resource, right, to help these families in whichever way I can in terms of case management, mental health services, referrals, being able to help them in that way, and then still embody that spirit of kapwa. And what kapwa is, it means togetherness. And so knowing that, we're not alone, and we're here to help out one another. Of course, it branches out, to different communities, but for me, myself, I'm working with Filipino families right now, and so I definitely feel that connection with them, and I just do my best.
Yeah, that's awesome. I'm gonna jump over one question to kind of expand on that.
Sure.
As a professional, how have you seen culture and language influence what's been offered, or what can be offered?
In terms of what can be offered, in terms of accessibility, or
kind of, yeah. Well, because you're saying now that having clients who are all Filipino, you're able to do X, Y, Z with them, right? But how have you seen previously that maybe culture and language was a barrier, or there were like limitations?
Working with Filipino families or other communities of color, I've experienced like language being a barrier. In the medical setting, if we can't speak a certain language, whether it be like Armenian or Spanish, then would be like a language interpreter there. And a language interpreter could either be in person or on an iPad. And that there is a challenge as well too, because not only are you doing a clinical assessment and trying to build rapport with the patient, but then you're also waiting for the interpreter to then interpret what the patient is saying. And, and there could be also some things where then the patient or client is building more rapport with the interpreter than with you, or as a medical social worker, you convey the importance of the counseling or supportive services in terms of like depression, but then when the interpreter may relay that not everything is how you say, like, coherent or not as understood, because due to some cultural differences. Like, for example, I remember there was a patient and was talking about hearing voices and speaking about religion, and then the medical social workers I was shadowing then talked about asking for like signs and symptoms, and then the interpreter didn't explain it in a clear way. So then the patient was left with more questions. And the reason why I know this is because the medical social worker I was working with knew some Spanish as well too, and said like, that's not what I said, but you said it differently. Yeah. I mean, not to knock like interpreters, but sometimes that's a barrier, right? Like in terms of like how you understand a patient, a client, and how you relate to that person, how you can be sure that you are on the same page.
Yeah. Like they may, as an interpreter, they may know the language, but they might not know from the medical side, like what is the purpose of the question, or like what are they trying to get to?
Right. Like yeah. Because like what we're trying to get to there was seeing like, oh, so are there instances of hallucinations or delusions, like more so like that. Yeah. And then also, yeah, how's that different from maybe hearing voices of God as opposed to hearing voices of themselves, right? So again, that cultural component as well too. So like it can be typical to hear voices of God speaking to you, right? So again, yeah, that cultural component is very important to consider that. And how's that different from hallucination, right? When you have like another voice is telling you to do something.
Yeah. How do you kind of separate that out? And trying to factor in folks' spirituality.
Yes.
So, what do you think has been most challenging then? Just overall, maybe it's the language barrier, but maybe is there something else that's like the most challenging part about your job?
The most challenging part of my job, and it took me some time to learn it, is to be flexible. Because you may go into a session ready to do an assessment, ready to provide these resources, but maybe right then and there, the client may cancel. Maybe right then and there, the client may exhibit crisis, or may then disclose suicidal ideation, and then you're in a safety planning mode and being sure that that client is safe. And so the most challenging part of it, I feel, is learning to be flexible and expecting it, like one option A may happen, or option B or option C may happen. And so just being ready for those changes to come about. And all the same while to be natural about it too, right? Like not be as rigid. And being sure that you're able to connect with a person. Like you're not there like as an interviewer. Like we're not interviewers, right? We're clinicians. And so while we may have some questions, and we, to have a better understanding of the patient, you're not asking in a way like, okay, you told me this one. Okay, how about this one? How about this one? How about this one? Right? Yeah. You want to build up the strengths. You want to be sure that they're heard.
Yeah, that's a great point about being a social worker. In my experiences with trying to coordinate with social workers in my current job, I've noticed that always be prepared for like last minute changes, because there could always be some kind of crisis that comes up with the client. And so I think that's a very real part of being a social worker. And if this is a profession that you're interested in, trying to get comfortable with that uncertainty.
Right. Yes, definitely with the uncertainty.
Yeah. But then also, as you mentioned, focusing on the person.
Right.
Okay. Yeah. And being flexible, where it's not just, okay, well, this is our goal today, we have to get to work. Where it's really about trying to support the person,
Right, yeah, because it's about going where the patient, the client is at, right? If the person is not ready to go into that part of the assessment, then don't force it, right? Maybe then switch back and be, okay, let's build rapport more, where you talk then just more about family, something that they're able to disclose more. And it's about that, and it relates back to this concept of self-determination as well too, where you are being patient with them, and just going with wherever the conversation leads. I mean, so of course, like you'll guide here and there, but then not make things too forced. Yeah.
So you're meeting them where they're at and kind of letting them take the lead, sort of. Yeah. So if someone really wants to provide resources to their community as a social worker, what advice would you give to current undergrads who want to pursue this profession?
I would advise y'all as much as possible to dive into those internships, to dive into those extracurricular activities, whether it be volunteering, because I didn't mention this, but I also volunteered at an Alzheimer's care home one time. And with these internships, with these volunteers, then you'll have a better sense of an idea of what population you would like to work with and which population you do not want to work with. And do your best to not feel down if like, oh man, like I expected to like work with this, just with families, but then I work with just adults and more setting like addiction. Then you'd be like, oh, okay, then that's what you gravitate to. Like work on what you are most comfortable with, right? I mean, of course, have the challenges there, but if you force yourself to be in a population or a setting that you're not equipped or ready to, then don't force it. So definitely experience as many internships as you can. If you get a paid internship, that is always a plus. That's very rare. It's hard to find. Even at USC, I was at Kaiser and I was doing all the work as medical social workers, but I was not getting paid or a stipend. I mean, that's a whole other issue in general. Yeah, but those internships help. It really helps. And I talk a lot about medical social work, and the reason why I'm now in community-based mental health I want to touch upon is that while I was able to learn about the challenges and difficulties being in medical social work and how it's more high acute cases, and it was something or like an area that I felt that I wanted to challenge myself in, and I definitely learned a lot. At the same time, I wanted to really combine my the community aspect with mental health, and I did not get to do as much of that at Kaiser Permanente or like in a hospital setting. And so
because it's not community.
Yeah, it's not community. I mean, you might see some folks from the community, but it's not, right? Yeah. And so when SEPA then started to revitalize the mental health programs, and I saw the opening, then I jumped on that, and I'm loving it so far. And so yeah, so really like explore and see what you like and what you don't like. And it's okay if you don't like it, just you switch. Yeah. And just roll with it.
Thank you for that advice. So now we'll switch to a couple of student questions.
Alrighty.
So Eddy, go ahead and choose a question. Let us know who asked it. It's the person whose name is above the question asked it.
All right. So Karina Juan Garcia said, I saw that you also graduated in criminology. How has the knowledge in that area helped you become a better counselor? So with criminology, how that helped me is in terms of understanding systems, because in criminology, I learned a lot about like the prison system, I learned about the rehabilitation system, learned about the psychology of police officers and offenders. And so taking all of that into account when working with an individual that may be involved in criminal prosecution or whatnot, but like how does that affect a person? When you think about the school to prison pipeline, for example, And when you have youth then, you know, funneled into the prison system, then how is that restorative justice, you know, or how about their mental health? You know, within what counseling services are they receiving there? And so it really, I guess in a way, yeah, helped me understand a more systems approach, the micro, the meso, and macro. And that's when I first got into that. Now I have this language, like saying, you know, like those systems. But at the time when I was an undergrad, I didn't. But then as I was learning it, I still was able to look at a larger picture than just what was happening just with an individual one-to-one. Like, okay, like, oh, how about the family members? Okay, how about the probation officer? Or how about the larger system in place?
And so I think that's a great compliment to psychology, which is typically individual focused, right? So you're able to combine like the systems approach with criminology, with the concept of psychology.
Yes, and that is social work 101, all about systems. Yeah.
Maybe choose one more question.
Oh, one more. Okay. Oh, there are a lot of good questions here. Thanks, y'all, for submitting them. I don't know. They're all pretty good. Okay. So let's go with... Okay. Also, okay, said... my question for, this is from Pauline. Thank you, Pauline. My question for you is, what made you decide to major in several different fields? Also, after graduating with your bachelor's, why didn't you continue with psychology or criminology when getting your master's? So what made me decide to major in several different fields? Well, to clarify, so I know in my resume it says psychology and social behavior, that there is one major. And then criminology and law and society, that there is another major. And so it's two majors. And the reason why I wanted to combine those, because initially I thought I wanted to be a probation counselor. And, you know, when I was an undergrad, I really wanted to explore my options and see what kind of classes I'm interested in. And those two stuck out to me the most. And then to follow up with your second question, why didn't I continue with psychology? I believe that's what it was. And so I want to emphasize that, well, with social work, there are components there of psychology. There's a components there of criminology as well, too. Like, just because I major in psychology doesn't mean I have to be a psychologist or have a master's in psychology or a doctorate in psychology. There are plenty of different fields that you can dive into. And social work happened to be a good mesh of my interests. Another field I possibly could have went into is also marriage and family therapy at MFT. The reason why I didn't go to MFT, and if you like MFT, you know, all the power to you. I was drawn to social work because of the focus on systems. Not to say that MFT doesn't focus on systems, but I feel more so MSW focus more on what is happening with the family in the context of like school, in context of poverty, of culture, really of all those components. And I'm able to have flexibility as well too with social work. Like, I could be a counselor as I am right now. I could be a union organizer. I could work in higher ed as well too as counselor there, academic advisor even. It gives a lot of options there. And right now I'm very happy with where I am at SEPA as an in-home outreach counselor, because I'm able to combine all those worlds. So yeah, in a nutshell, like your major doesn't determine exactly where you'll be, but it can guide you into what fields are out there.
Yeah, definitely. I think it's important to think of undergrad majors as what is going to inform your lens going forward, not necessarily prescribe what it is that you are going to be. So on that note, thank you, Eddy, so much for speaking to our class, and we hope you enjoy this video.
Alrighty, thank you.